Hi, I'm Naomi from the Academy of Fitness. I'm now going to show you how to do a pre-exercise screen using the adult pre-exercise screening tool. I'll be showing you stages 1 and 2 today. Prior to beginning any pre-exercise screen or any fitness appraisals, it's really important that you obtain something called informed consent from your client. Informed consent is not simply telling your client what it is you're about to do, but it's about giving them as much information as possible so that they can make an informed decision about whether or not they wish to participate. With your pre-exercise screen and your fitness appraisals, your client does not have to participate in anything that they are not comfortable with. This, however, may mean that you are not able to accurately obtain their risk stratification. If this is the case, you must inform your client of this, as you may not be able to write a program for them. They can then take that advice on board and choose as to whether they wish to participate or not. Okay, Dave, I'm about to take you through the adult pre-exercise screening tool. The purpose of doing this is to ask a series of questions to try and get as much medical information about you as possible. The reason that we do that is we need to try and identify what's called contraindications to exercise. And a contraindication is anything that, if present, can be potentially harmful to you while you're exercising. And it can be something as simple as a sore ankle through to something as serious as cardiovascular disease. I'll be asking questions in stage 1 here, and then we'll flick over and we'll go to stage 2. In identifying these contraindications, it helps me to determine what is an appropriate level of exercise for you to work at, so what intensity. It also then helps me to determine what exercises I should actually put into your program. One of the most important things, though, I can get by doing this pre-exercise screen is it tells me whether I need to refer you to get medical clearance by a doctor.
Yep.
Are you happy for me to go ahead with this?
Yeah, totally, it's fine.
Excellent. Okay, so this stage 1. The aim of the stage is to identify those individuals with a known disease or signs or symptoms of disease who may be at a high risk for an adverse event during physical activity or exercise. Now, normally this stage can be self-administered or self-evaluated, but because I'm here with you today, I'll take you through this.
Yeah.
Okay, the first question. Has your doctor ever told you that you have a heart condition or have you ever suffered a stroke?
No.
Do you ever experience unexplained pains in your chest at rest or during physical activity or exercise?
No, not at all.
Fantastic. Do you ever feel faint or have spells of dizziness during physical activity or exercise that causes you to lose balance?
No.
Good. Have you had an asthma attack requiring immediate medical attention at any time over the last 12 months?
No.
Brilliant. If you have diabetes type 1 or 2, have you had trouble controlling your blood glucose in the last 3 months?
No.
Excellent. Do you have any diagnosed muscle, bone or joint problems that you have been told could be made worse by participating in physical activity or exercise?
No.
And do you have any other medical condition or conditions that may make it dangerous for you to participate in physical activity or exercise?
No, not at all.
Fantastic. I'll get you to sign just down the bottom there for me, Dave. Okay, because you've answered no to all of these questions, we can now progress on to stage 2. So just turn over the page. Okay, so the aim of this stage is to identify those individuals with risk factors or other conditions to assist with appropriate exercise prescription. This stage is to be administered by an appropriate exercise professional, which will be obviously me today. Okay, Dave, I just need to find out how old you are.
I'm 40.
Wonderful. So, because you are 40 and you're a male, that means that you do not have a risk factor for your age and gender, so that's fantastic. Have you got or do you have a family history of heart disease, such as stroke or heart attack?
Nothing like that, no.
Okay. Do you smoke?
Never in my life.
Wonderful. Okay, we need to have a look at your current physical activity levels. Would you consider yourself sedentary, or do you participate in light, moderate or vigorous exercise?
Moderate.
Wonderful. And how many sessions per week?
5 times a week.
For how long?
60 minutes.
Excellent. So that's about 300 minutes,
Yeah.
which means you have gone above the recommended guidelines of 150 minutes per week, which is fantastic. That gives you a -1 risk factor, so it's brilliant. Okay, your height and your weight. So your height was?
175 centimetres.
175, and your weight?
90 kilo.
90 kilos. And we worked out earlier that that gave you a BMI of 29 kilos per metre squared, which keeps you underneath the risk factor there of greater than 30 kilos per metre squared, so that's wonderful.
Yeah.
Have you ever been told that you have high blood pressure?
No. No.
Great. Have you ever been told that you have high cholesterol?
No.
And have you ever been told that you have high blood sugar?
No.
Excellent. So on this page, you're actually at -1.
That's good.
Wonderful. Okay, a couple more questions. Have you spent time in hospital, including day admission, for any medical condition, illness, injury during the last 12 months?
No.
Brilliant. Are you currently taking a prescribed medication or medications for any medical conditions?
No.
Great. And I'm assuming that you're not pregnant or haven't given birth in the last 12 months. Fantastic. And do you have any muscle, bone or joint pain or soreness that is made worse by particular types of activity?
No.
That is brilliant. Okay, so what we now need to just assess is what's called your risk stratification. And this, by what you've answered in the pre-exercise screen today, I'm able to ascertain that you are a low risk client. So you can either be low, moderate or high risk. So you have a total of -1, which makes you a low risk client. So individuals at low risk may participate in aerobic physical activity or exercise up to a vigorous or high intensity. And if we have a look at it at this table over here, here is our vigorous and high intensity. So you are able to exercise up to a level of 90% or greater of your heart rate max, which in terms of your RPE or your rate of perceived exertion, that's greater than 7. The other wonderful point is that we don't need to refer you for medical clearance, so you're able to undertake an exercise program today.
Cool. Awesome.
Wonderful. Thanks, Dave.